Have you ever wondered how a health crisis could silently fuel another crisis, such as homelessness and unemployment? In the heart of America, a silent and insidious crisis is raging. Known as the opioid crisis, it's a ticking time bomb that's having catastrophic impacts on our society. Opioids, a category of drugs that include the illegal drug heroin, synthetic opioids such as fentanyl, and pain relievers available legally by prescription, were originally developed to help manage pain. They were seen as a breakthrough in medicine, offering relief to those suffering from chronic or acute pain. But like all good things, misuse has turned this blessing into a curse. With each passing year, the United States is witnessing a rapid increase in opioid addiction. This addiction is not just a personal battle, but it's leaving a trail of devastation across the country, fueling homelessness and unemployment on an unprecedented scale. As we delve deeper into this crisis, it's important to note that opioids were initially intended for good, pain relief. However, misuse has led us down a dangerous path. So how did we end up here, in the middle of a national opioid crisis? Let's take a step back and look at the origins of this crisis. The late 90s marked a turning point in medicine. Pharmaceutical companies, with their shiny new opioid pain relievers, reassured the medical community that these miracle drugs were not addictive. Doctors, eager to provide relief to their patients, began prescribing these medications at an unprecedented rate. But as the new millennium rolled in, so did the first signs of trouble. Reports began to surface of patients becoming dependent on these supposed non-addictive drugs. An alarming increase in opioid-related deaths was noted. However, these warning signs were largely ignored or downplayed. The pharmaceutical companies continued to push their products and doctors continued to prescribe. By the end of the first decade of the 21st century, the opioid crisis had taken root. The number of opioid prescriptions had quadrupled since the late 90s, and so had the number of opioid-related deaths. Yet, the alarm bells were only just beginning to ring. As we moved into the 2010s, the crisis escalated into a full-blown epidemic. Prescription opioids were now being replaced by illicit drugs like heroin and fentanyl, which were cheaper and easier to obtain. The number of opioid overdose deaths skyrocketed. By the mid-20s, the crisis had spread like wildfire, reaching every corner of the country. It was no longer confined to the dark alleyways of urban cities or the quiet streets of suburban towns. It was everywhere, and the cost? Staggering. Not just in terms of lives lost, but also in the impact on our healthcare system, our economy, and our society. The opioid crisis is more than just a public health issue, it's a societal issue, a humanitarian issue. Fast forward to the present day, and we are in the throes of an opioid epidemic that shows no signs of slowing down. But what happens when an addiction takes over your life? How does it affect your livelihood, your home? Let's dive into the heart of the matter. Picture a life flipped upside down by opioid addiction. It's a harsh reality for many, where the pursuit of a fleeting high trumps everything else, including the roof over one's head. The opioid crisis and homelessness are two societal issues that are increasingly entwined. Addiction, as we know, can be all-consuming. It can derail careers, fracture relationships, and yes, lead to homelessness. When the need for a fix overshadows the need for food and shelter, the results are devastating. In cities across the nation, the rise in homelessness mirrors the escalation of the opioid crisis. As opioids became more prevalent, so did the number of people living on the streets. In fact, it's estimated that nearly a quarter of the homeless population in the United States struggles with substance abuse, including opioids. And it's not just a coincidence, there's a clear cause and effect relationship here. Opioid addiction can lead to job loss, which in turn can result in an individual or family losing their home. Without a stable living situation, it becomes even harder to seek treatment or find employment, creating a vicious cycle that's hard to break. But it's not just the addicted individuals who suffer. There's a ripple effect that touches everyone around them. Families are torn apart. Children are left without parents. Communities are left to deal with the fallout. Moreover, the cost isn't just emotional. There's a financial toll as well, with billions of dollars spent annually on healthcare, social services, and law enforcement. So the next time you pass by someone on the street, remember, they might be fighting a battle you know nothing about. Behind each homeless individual could be a story of addiction, a struggle with opioids that led them to where they are today. Homelessness is only one of the many consequences of the opioid crisis. It's a ripple effect that spreads far and wide. Beyond losing a home, what about losing the ability to sustain oneself, to work? In the intricate web of the opioid crisis, the threads of unemployment are tightly woven. To understand the full impact of this epidemic, we must consider not only the devastating health consequences, but also the economic implications. The opioid crisis has not only shaped our society's health landscape, but also our workforce and economy. Opioid addiction and unemployment share a complex two-way relationship. On one hand, addiction can lead to job loss. Those struggling with opioid addiction often find it difficult to maintain consistent employment. The physical and mental toll of addiction, coupled with the time-consuming nature of substance use, can make it challenging to fulfill work responsibilities. This can result in job loss, pushing individuals further into the cycle of addiction and poverty. On the other hand, job loss can exacerbate addiction. Unemployment often brings with it financial stress, social isolation, and a sense of hopelessness, all powerful triggers for substance use. For someone already battling addiction, the loss of a job can be a tipping point, leading to increased drug use and a deepening of the addiction. The statistics paint a grim picture. As the opioid crisis has escalated over the past 2 decades, so too has unemployment. Areas hardest hit by the opioid crisis have seen the steepest increases in joblessness. This isn't a coincidence, but rather a reflection of the intertwined nature of these two issues. This link between opioid addiction and unemployment isn't just a theoretical concept, it's a lived reality for many. Behind every statistic is a person grappling with the harsh realities of addiction and job loss. It's a mother struggling to provide for her children, a father unable to find work, a young adult with dreams and ambitions put on hold. The vicious cycle of addiction and unemployment is a heartbreaking reality for many. This isn't simply an issue to be debated and dissected in boardrooms and policy meetings. It's a human crisis that demands compassion, understanding, and most importantly, action. The opioid crisis, homelessness, and unemployment, 3 interconnected issues, but what can we as concerned citizens do about it? Well, let's dive in. The first thing we need to do is educate ourselves. Knowledge is power, as they say. By understanding the intricacies of the opioid crisis, its roots, and its far-reaching impacts, we can begin to unravel the threads that tie it to homelessness and unemployment. There are many resources available online, from academic studies to news articles, documentaries, and first-hand accounts. It's important to approach this issue with empathy and open-mindedness, recognizing that addiction is a disease, not a moral failing. Secondly, we can use our voice to advocate for effective policies. This means supporting initiatives that tackle the root causes of the opioid crisis, such as improving access to mental health services, implementing harm reduction strategies, and addressing social determinants of health like poverty and education. It means pushing for legislation that holds pharmaceutical companies accountable for their role in the opioid epidemic. And it means fighting for policies that provide support and resources for those struggling with homelessness and unemployment. But advocacy isn't just about policy. It's about changing the conversation around addiction and homelessness. We can challenge stigma by sharing accurate information, speaking out against harmful stereotypes, and elevating the stories of individuals who have lived these experiences. Thirdly, we can support organizations that are already doing the hard work on the ground. This could mean donating money or time to local nonprofits providing housing, job training, or addiction treatment services. It could mean participating in community cleanups or harm reduction efforts. Or it could mean using our professional skills to help these organizations in other ways, like offering legal advice or helping with their marketing. There's also a role for businesses and employers to play. Companies can implement policies that support employees who are struggling with addiction, like providing paid leave for treatment or creating a supportive return-to-work program. They can hire people who have been affected by the opioid crisis, giving them a chance to rebuild their lives and contribute to their communities. And finally, we must remember that change takes time. It's easy to feel overwhelmed by the magnitude of these issues, but every small action adds up. Every conversation that opens someone's eyes to the reality of the opioid crisis, every dollar donated to a nonprofit, every supportive policy enacted, it all contributes to the larger goal of addressing this crisis and its impacts on our society. Remember, the first step towards change is awareness. Learn more about the opioid crisis and how you can make a difference. Your voice and action matter.